Well, hello there. This is Dr. Karyn Dornemann, and I'm here to talk to you today about when to use ice and when to use heat. Now, this is often the most frequently asked question when I have a new patient. They come in with an acute injury and they want to know, should they be using ice on their low back or their neck, or should they be using heat? Now, I'm going to tell you a little bit about why to use one versus the other. Most of the time, when you're having pain, you're going to want to use ice. And ice packs that are soft and flexible are actually the ones that I like people to use the most, instead of an ice pack made with ice cubes or put in like a hot water bottle kind of arrangement. The reason for this is that this will help mold to the surface, okay? And that's what you need to have when you're using ice, is lots and lots of surface contact. Now, you want to make sure when you're using ice that you make sure you have a layer of cloth, and just, a shirt or whatever, a tea towel is sufficient so that you don't get freezer burn on the area that you're icing, okay? And secondly, you also want to make sure you don't wrap this in like a big terry cloth towel, such as something like this, because then it will insulate and you won't get cold. And the whole idea of using the ice is to get the area chilled down. Now, the reason for this is because when you have pain, pain travels on nerve fibers from the area of pain up to your brain, okay? And when you put ice on it, you do two things. Number one, you stop that transmission of pain from that area to your brain, because it gets overridden by the sensation of cold. The second thing is that you start to reduce inflammation and swelling. And those are two very important things to have happen when you have an acute injury. Is you want to reduce the pain, the inflammation, and the swelling in the area. So you're going to use the ice over the area of pain for about 20 to 25 minutes, or until the pack has kind of warmed up. And these things, they tend to warm up a little bit, after you use them for a while. So you want to make sure you leave it on sufficiently, but not too long. Some of the more popular packs are these ones with like these peas in it, and they're very nice. And you can pick these up at your local drugstore, Walmart, CVS, that kind of thing, okay? Now, so most of the time I will have patients use ice, and if you're in pain and it's acute pain or pain that's kind of sudden pain or sharp pain, I would prefer that you ice. Now, a lot of our patients like hot packs, and here's a hot pack. This is what we use in the office. It's a hydrocollator. It's great. It really delivers wonderful warm heat, and it's moist heat too, so it tends to penetrate. Now, at home, this is going to be something that you're going to find difficult to do. So if you have heat at home, you're probably using one of those plug-in electric heating pads. And may I say this now, take the thing and put it away where you'll never find it again. Dry heat is not great, okay? What dry heat does is it irritates the skin, causes some warmth, and it causes blood vessels to kind of put some tissue fluid into the area. So what happens is you get a lot of what I would call kind of like soggy, boggy, like a sponge all filled up with fluid, and the area retains a lot of heat. And when you have more fluid in the area and more heat in the area, guess what? It's going to hurt worse, and it's going to be more inflamed, and it's going to be more swollen. So you're kind of doing the exact opposite thing that you want to do by using the heat, okay? Now, if you are told to use heat in this office, which is going to be pretty rarely, we do want you to use a moist heat, which is why when you come into the office, if you need the heat, we will apply it here. But if you are going to be using something like heat at home, make sure it's a moist heating pad. Make sure it has the availability to deliver moist heat, not dry heat. And you only want to use this for about maybe 8 to 10 minutes. You don't want to leave it on there for an hour and a half. Do not go to bed with the heating pad. That's a bad idea. Another thing, if your car has heated seats, be very careful, because those heated seats can also cause a lot of irritation to your lumbar spine. Even though you think you're doing the right thing, just leave those things off for now, okay? All right, if there's any questions, don't hesitate to call the office. It's 518-828-2133. You can find us, of course, on Facebook at Hudson Chiropractic, and you can also email us at hudsonchiro@yahoo.com, or we'll see you in your next appointment. Until then, be well and enjoy your ice and your heat.